My name is Heather Jones. I'm a nephrologist at Eastern Nephrology Associates. I practice both general and transplant nephrology.
I'm Dr. Noman Shahid. I've been with this practice for about 12 years. For the past many years, I've been spearheading the efforts about value-based care.
Value-based care is a different approach to taking care of a patient with chronic kidney disease. Traditional fee-for-service care focused so much on what happens between the doctor and the patient and sort of intensive procedures, whereas value-based care focuses on so many things that impact a patient's quality of life that happen outside of the doctor visit, whether it's a nurse checking on a patient between visits to make sure they're not having medication side effects, whether it's a social worker checking in to make sure that the patient has ability to access things like food and transportation, whether it's a dietitian.
Our desire is that none of our patients goes on needing dialysis. It's very important to help our patients do what needs to be done to slow the progression of kidney disease in terms of providing education about their health conditions, reducing the risk of hospitalizations.
Many of our patients have multiple complex medical diseases outside of the kidney disease that they're dealing with on a daily basis. Partnering with Interwell Health has helped us capture that data so that we're mindful of the other conditions that they're dealing with, and also making sure that we're able to integrate kidney care with the other aspects of their care so that we're thinking about the patient more holistically.
Data analytics help us identify the care gaps, such as our ability to focus on those patients who we have not been able to follow at a certain frequency, who are at risk of high-risk progression of kidney disease, who are at risk of getting admitted to the hospitals. Zooming out and looking at all your patients at once and identifying where your attention and focus needs to be, this is important. And I think with our partnership with Interwell Health, access to their skilled data analytics team has certainly helped us identify those areas which were not visible to us. A lot of physicians ask about our experience with value-based care and what are some of the successes that we have noticed. And I think it's not hard to count them. We have about 85% patients starting dialysis optimally. By that I mean that they're starting dialysis with the dialysis access that is deemed permanent and stable and long-term. I think this is a success in itself. If you look at the national average, the rate of optimal starts before value-based care was very, very low. I would also say for a lot of our patients, about 40% and above are starting dialysis at home, which we know is associated with a lot of physical, emotional, and better outcomes for our patients.
We are seeing a lot of movement on the preemptive transplant front. We've been able to grow a very robust preemptive referral program at Eastern Nephrology Associates. We've grown our preemptive referral volumes from about 85 patients a year to almost 400 referrals per year. And with a growing preemptive referral population, you get a growing preemptive transplant population.
There's nothing more fulfilling than to see a patient avoiding dialysis altogether by getting a preemptive kidney transplantation without ever stepping a foot in the dialysis unit. I think this is a win of a special kind. I think Interwell has an edge over its competitor due to its expertise in value-based care. Interwell started this journey earlier than many other players in the market. Interwell also has a very skilled team of care coordinators, data analytics, and particularly an EMR which is geared towards success in value-based care acumen. So all these things make Interwell Health a leader in the value-based care world as a partner for practices like us.